Tonight, new information confirming what many feared, the impact of the pandemic on reports of child abuse and neglect across Illinois. News Channel 20's Jordan Elder joins us live now with how law enforcement says COVID-19 affected their mandated reporting. Jordan?
Every police officer is a mandated reporter. That means if they see signs of child abuse or neglect, they have to report it. After the stay-at-home order earlier this year, they say they saw those reports going up. In an Illinois Senate committee hearing Monday, DCFS reporting a statewide increase in abuse and neglect reports by law enforcement.
Law enforcement reports increased by 7% in July and August over the previous year.
Sheriff Jack Campbell says this trend was mirrored right here in Sangamon County.
We saw an immediate uptick back in the springtime and then early summer. Since then, it's kind of flattened out for us. It's still a concern because it's still slightly up from where it should be.
But with remote learning and many people quarantining at home, Campbell says this was no surprise.
I think we all anticipated that, and I think nationwide that's what happened across the country, and I think it was just natural given the gravity of the situation.
Because of the pandemic, police became some of the only people able to check on the safety of children in their own homes.
It's important that when officers go to these homes to investigate disturbances, that they take notice and report these incidents.
As DCFS hotline calls from schools dropped, law enforcement stepped up. They say especially in a pandemic, mandated reporting is an important part of their job.
To ensure we protect the residents of our county, in this case is protecting the smallest residents.
Now as the state reopens, hotline calls and the number of DCFS investigations are spiking.
That's not something we want to hear, but if our officers are having an impact in getting those incidents reported, I feel that that's an important role that they play.
Sheriff Campbell says about half of our county's reports come from people calling in. The other half come from deputies out in the field. Live in Springfield, I'm Jordan Elder. John?
Thanks, Jordan. Now, DCFS says that their total calls this year are lower than 2019 numbers, but the gap is closing. Right now, the difference between this year and last year is about 18%.
Changes coming to the Department of Children and Family Services Abuse and Neglect Hotline. Now, this is coming after a 2019 audit claiming the department was too slow in completing intakes. In the first week of September, DCFS only had to call back 26 people to complete their intakes compared to over 2,000 during that same time just last year.
The phone system is also getting an update that will allow reporters to identify the type of reporter they are, which allow the hotline workers to identify the reporting role of the caller prior to taking the call.
Hopper says the department's hotline employees are still working from home. DCFS hired 40 new hotline workers at the start of the pandemic.
Tonight, some shocking new findings. Children in DCFS custody were reportedly kept in psychiatric hospitals for an average of 50 days after they were already cleared to leave.
News Channel 20's Jordan Elder joins us now in studio to tell us what's happening. Jordan?
Stacy, the numbers are troubling. As you can see here, year after year, more children are being kept in hospitals for longer than they need to be there, waiting for placement in foster homes. This last year, 314 children. This is the highest since 2014, and it's costing Illinois taxpayers millions. For years now, Charles Goldberg, the Cook County Public Guardian, has been using Freedom of Information Act requests to track trends in DCFS hospitalizations.
More and more kids, longer and longer lengths of time, younger and younger children.
Goldberg says the department kept over 300 kids in psychiatric hospitals longer than necessary because they can't find placement in foster homes. On average, they stayed 50 extra days.
When we sued them about this 2 years ago, they said, "Oh, this is horrible. We're going to fix this. We can't let this happen." And each of those 2 years, it's gotten worse.
But last week in a Senate committee hearing, DCFS changed their tone.
I'm not going to sugarcoat and say we're doing everything to try and move kids on, because we are. We're struggling with that on a daily basis.
But child psychologist Bill Moordock says it may already be too late. These hospitals are designed for short-term stays. Months of isolation may have drastic effects on children in the future.
They're going to lose a lot of ground. They're going to lose educationally, they're going to lose socially, physically, developmentally.
Moordock says it's urgent this problem is solved because it could cost kids their mental health down the road. Goldberg says these hospital stays reportedly cost the state over $6 million last year, and he says that money comes straight from taxpayers.
This is a waste of money as well as a waste of children's lives.
Goldberg says the key to fixing the problem is increasing efforts to place these kids. DCFS says this is a long process that can't happen overnight. But Goldberg reiterated he brought this to the department's attention 2 years ago and says they still haven't made that effort. In studio, I'm Jordan Elder. Back to you.
All right, thanks for that report, Jordan. In a statement, DCFS reporting there are currently 34 children sitting in psychiatric hospitals around the state, currently waiting for placement. Since July, the department reports 61 youth have been removed from these situations and placed in foster homes.